Hey doctors, welcome to Pocket MBBS where medicine fits in your pockets. Now let's study today's topic, it is endometrial carcinoma. Endometrial carcinoma is commonly called uterine cancer. It is most common pelvic malignancy in females. It is common in postmenopausal women in their 6th and 7th decade of life and uncommon below 40 years. Its features are abnormal bleeding in postmenopausal women and excessive flow in premenopausal years. Classified into two types, type 1 and type 2. Endometrial hyperplasia is increase in the growth of endometrium, which is a precancerous stage before the endometrial carcinoma. It is divided into three types: simple hyperplasia without atypia, complex hyperplasia without atypia, and complex hyperplasia with atypia. Now the features of simple hyperplasia without atypia are increased number of endometrial glands. Glands are usually cystically dilated, no atypia is present, and no risk of progression to cancer. Complex hyperplasia without atypia, increased gland crowding, less intervening stroma, irregular branch of glands are present, and no atypia. Complex hyperplasia with atypia, marked gland crowding, nuclear atypia present, enlarged irregular nucleus, irregular branching of glands, and high risk of progression to cancer. Cytological atypia features are enlarged nuclei, nuclear pleomorphism, loss of basal polarity, prominent nucleoli, increased mitotic activity. Simple hyperplasia without atypia, in which we see cystical dilation of gland, compact stroma, and nuclear stratification. Complex hyperplasia without atypia, in which we see papillary infolds, back-to-back glandings, and dense stroma. Complex hyperplasia with atypia, we see nuclear atypia, back-to-back glands, and papillary infoldings. Now, endometrial carcinoma, type 1 endometrioid carcinoma and type 2 non-endometrioid carcinoma. Type 1 predisposing factors are chronic unopposed estrogen excess and obesity. Type 2 predisposing factors are atrophy of endometrium and thin physique. Other predisposing factors of type 1 endometrial carcinoma are diabetes mellitus, hypertension, nulliparous state, heredity, and polycystic ovarian disease. And other cause of type 2 hyperplasia is elderly women. In elderly women it is more common. Pathogenesis of type 1 is mutation or inactivation of PTEN gene or mutation in PIK3CA or PIK3RI, KRAS, and TP53 gene. Pathogenesis of type 2 is mutation in TP53 and PIK3CA, FBXW7 and PPP2KIA genes and germline BRCA1 or 2 mutations. Microsatellite instability is also seen in type 1. Now the precursor reasons for type 1 is endometrial hyperplasia and type 2 is atrophic endometrium. Histological type is endometrioid adenocarcinoma and type 2 serous carcinoma and clear cell carcinoma. Precursor lesions are atypical endometrioid hyperplasia. Here in type 2 serous endometrioid intraepithelial carcinoma. Prognosis of type 1 is good and type 2 is poor. Now the gross of endometrial carcinoma is localized polyploid tumor, diffuse tumor, soft friable grey white tumor, may show hemorrhage and necrosis. Microscopy 3 patterns: well differentiated, moderately differentiated, and poorly differentiated. Well differentiation means increased number of glands and back-to-back crowding of glands due to obliterate intervening stroma. Moderately differentiated show above features along with the presence of some solid sheets less than 50% of malignant cells. In poorly differentiated, we also see presence of solid sheet and more than 50% of malignant cells which show marked cytological atypia and frequent mitosis. Glandular pattern is hard to find in poorly differentiated endometrial carcinoma. Now, clinical features of endometrial carcinoma is postmenopausal women bleeding, abnormal uterine bleeding, blood-stained vaginal discharge, pelvic pain, weight loss, and excess flow in postmenopausal years. Now, spread of endometrial carcinoma is spread direct invasion, in which underlying myometrium and extend into the periuterine structures. Lymphatic spread to the regional lymph nodes and hematogenous spread to the lungs, liver, bone and other organs. Diagnosis is transvaginal ultrasonography, thickened endometrium. Other diagnosis methods are endometrial biopsy, histopathological examination and MRI for staging. The H&E image of endometrial carcinoma, in which we see back-to-back glands crowding, cellular atypia and infiltration into the stroma. Now that's all for today's videos. Thank you. Follow for more such videos.